Hello, welcome everyone to today's live presentation. Today I am going to speak on a little different topic, interesting, and that is why we personally do ImmuLIT procedures. Isn't it a little different topic? So, I am Dr. Mohan Raut, and I am a clinical reproductive immunologist as well as a gynecologist. And me and my wife, we are the only two clinical reproductive immunologists in India recognized by uh, the American board. We have our centers across India in Pune, Nagpur, Bangalore, Delhi, Hyderabad, apart from Mumbai. And at these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using the immunological treatment of ImmuLIT, which is a patented and branded form of lymphocyte immunization therapy practiced at our centers, that is Dr. Rauts Centers for Reproductive Immunology, along with other immunomodulatory treatments. So today, why I am speaking on this little unusual topic of why we do ImmuLIT personally. The reason why we have selected this topic is many times our patients ask us, doctors, you have different centers. I am staying close to Delhi. I want to come to Delhi. But then who will do the procedure there? Will you be there? Or someone from Hyderabad says, oh, your center is in Hyderabad. We will come to Hyderabad. But it is only if you are doing, we will come. Otherwise, we will come to Mumbai. So we tell them that at all these centers, we do the treatment personally. That is Dr. Mugdha, my wife, and me. Together, we do the procedures at all these centers. Then they ask, why, doctor? Why you are personally going to these centers and doing the treatment? You can always delegate it to someone to do the procedures. So, friends, the reason why we have been doing personally this statement is because it is very important that a particular procedure is followed properly for the best success rate. Now, the treatment of ImmuLIT, which is a branded and patented process that we do, has been associated with a success rate of between 75 to 80%. So to achieve that success rate, we have to have all the steps in place. So if you see the factors that are required for successful results after ImmuLIT, the first is proper selection of couples. Of course, that is important after the all the immunological tests and properly selecting couples. But after that, the success depends on the procedure. So whether the procedure is done in the right way and with the right precautions, only then we will get the desired success rate. So there are different parts of the procedure. In this ImmuLIT procedure, the first step is collection of blood. Second process is processing the blood to separate the cells. And the third one is giving injection to the patient. Apparently, these appear very simple steps. Collection of blood can be done by anyone, any phlebotomist can do it. But it is very important to collect the blood with all precautions, with the right bore of the needle, ensuring that the cells are not damaged. Correct pressure applied in the negative pressure in the syringe, so that there are no air bubbles inside, there is no frothing of blood inside, and so that the cells are not damaged, because it is very important. Even hemolysis is not good for the functioning of the cells. So therefore a proper blood collection is required. So therefore even the blood collection part is done by us personally. Then the after collecting the blood, the processing part, there is a set protocol of processing the blood. So all the steps have to be followed strictly, so that you not only maintain the aseptic precautions, but particular concentration of cells is achieved by doing these processes. The particular concentration of lymphocytes, then the other components of blood, that is the red blood cells, platelets, the plasma has to be removed to the permissive and should be there only in the permissible limits in the cell preparation, and that is a very important step, and if that is not followed, then there can be problem. Even before processing, when the blood is collected, it has to be immediately processed. If it is not immediately processed, if it is stored, then that is also not good. I will tell you the importance of this after some time, because the second is the processing of the blood and right concentration of cells, and the third step is to maintain the is to give the injections of the lymphocyte preparation, and that is to be given at right site, at the right part of the skin, so that it achieves the maximum effect, and the immune response that is developed will be maximum with dendritic cells coming into play. So these three steps, that is collection of blood, cell separation and injection, if they are not done properly, then the results may not be proper. And for this, I would like to give one very important example of one large study. There was one large study, multicentric study, which was done in United States in 19, and it was published in 1999. It's called as recurrent miscarriage study or REMIS study. And in this study, patients who had repeated miscarriages were part of this study. So a double-blind study, and they were given they were given the lymphocyte immunization therapy, and the results were analyzed, and the results showed that lymphocyte immunization therapy is of no use in improving the success rate in patients who have repeated miscarriages. In fact, the study showed that the control group had better success rate than the treated group, and even the chances of miscarriages were more in the treated group. Now, when the procedure was analyzed, the way cells were separated when it was analyzed at different centers, the results that came out were shocking. There were a lot of irregularities in this trial. And what happened was, the first thing about at the stage of collection, the blood was collected and it was stored for a long time. It was stored for over 6 hours or overnight, and then the cells were separated. So when this was done, the immunomodulatory ability of lymphocytes just vanished. Why? Because the immunomodulatory effect of lymphocytes is because of the surface marker called as CD200. And this CD200 gets destroyed when the blood is stored. So if the cells are collected from the stored blood, it is bound to destroy CD200, which is what happened in the REMIS study, or also called as OBER study. So in fact, the blood cells that were used in that study had already lost their immunomodulatory effect. So that was one. Second is the cell separation process. In that study, the separation of cells was done in different centers in different ways. So therefore, there was no uniformity in cell separation. The concentration of cells which was used was also different, and it was at different centers, different concentrations were used. So there was no uniformity. And when it was injected in different ways: intramuscular, intravenous, subcutaneous. So the results that were obtained were different. They were not good. The success rate was poor. And this study concluded that lymphocyte immunization therapy is not a treatment which will help in couples who have repeated miscarriages. In fact, the failure of the poor success rate shown in this study was because of the poor technique that was used from collection till injection. So my point here is, the procedure of lymphocyte appears simple. Lymphocyte separation appears simple. Many of our friends say, "Oh, lymphocytes ही separate करना है ना, उसमें बड़ी क्या बात है?" But yes, there are so many factors involved, and if they are not taken care of, the adequate immune response doesn't develop, and then the success rate also goes down. Many times, our even friends sometimes ask, we have tried lymphocyte immunization therapy, it hasn't worked. So how come your success rates are higher? Now, what should I say? So the only thing we tell them is that we do the right procedure, and the way what we have researched and what we have been doing, which we have patented and branded. We are following that procedure at all our centers, and therefore we have made it a point that we will be there at all these centers to do the procedures. Our friends tell us, if you do the procedures, there is limitation in number of procedures that you can do. I say yes, but I am sure when what we tell them is the procedures that we are doing are the ones which are indicated and which are the ones which are done in the right way, and therefore they are associated with good success rate. So this is related to the procedure. Not only that, after that, so after doing the procedure, the subsequent follow-up is also important. And yes, so therefore, once we know from the beginning about from selection to the procedure of the to a procedure of the lymphocyte therapy or ImmuLIT, the follow-up becomes easier. The follow-up medications which are recommended to the patient are accordingly planned depending on the investigations. So that also becomes an important part to ensure success, where we are personally involved with the patient, with the doctors who have referred the patient. So many of our patients will vouch for us, or many of our doctor friends who have referred patients will vouch for us that we are with them, with the patient till the patient delivers. So that is out of sheer our interest to ensure that the patient succeeds, and this is without any fees also for that matter. So it is very important that we personally are there with the patient from start to the end. And one more advantage that we have is we are, as I mentioned, qualified clinical reproductive immunologists. So, being the only two in India certified by the American board, it is all the more responsibility on us to share our or give our skills or what we know to more and more patients. So therefore, in fact, we have been dedicatedly practicing in the field of reproductive immunology only, and what our obstetric gynec practice we have kept aside, and we are only working in this field at our different centers, and it is giving us more time to interact with our patients, to give them the right type of treatment and follow them up the right way so that they are successful. So finally, it is the purpose of all this is to give success to the patient. The couples who have come to us with repeated miscarriages 4, 5, 6, 10, 15, or IVF failures 2, 4, 6, 8, 10, and we have seen up to 22 IVF failures. So these patients, if they have immunological problem and if they are treated the right way, they can overcome their problem and become happy parents. So therefore, it is, and with this view in mind, we have been doing these procedures personally at all these centers to ensure the best success rate and to help as many couples as possible. I am sure you must be coming across patients like this who have repeated miscarriages or IVF failures or infertility in your practice for my doctor friends, and in your known to you for my patients and acquaintances. So if you know any of them, do extend this information to them about the use of ImmuLIT treatment. And if you share this information to at least one person, I am sure you will definitely change the life of that couple. And if you have any queries related to ImmuLIT, you can always be in touch with us on our helpline number, that is 9833201522. I'll repeat, 9833201522, or you can visit our website www.icprm.in www.icprm.in. So this is what I wanted to share about the queries of some of our patients about why we personally do ImmuLIT treatment. And if you have any more questions or queries related to ImmuLIT or the work that we are doing, please share with us these questions, and we will be happy to address those questions in these live programs, which becomes available to a large number of patients in at one go. So thank you so much for patient listening, and have great Navratri, and have a great week ahead. Thank you so much.